Imagine waking up one day to find your paradise island gripped by an unseen enemy. This is the reality that Puerto Rico faced at the beginning of 2024. The first whispers of an outbreak came as a shock, with the early signs dismissed as nothing more than seasonal flu. But as the initial cases began to pile up, the true nature of this adversary became apparent. It was dengue, a mosquito-borne disease, making a sudden and unexpected comeback. The public and health officials alike watched with growing concern as the situation escalated. As the number of cases rose to a staggering 549, it became clear that this was no ordinary situation. The escalating crisis left officials with no choice but to declare a public health emergency. The outbreak of dengue in Puerto Rico had reached such alarming proportions, it necessitated immediate action. The decision-making process leading to this declaration was fraught with urgency, as over 549 cases had been reported in the year 2024 alone. The role of climate factors in exacerbating the outbreak cannot be understated. Unpredictable weather patterns and rising temperatures create ideal conditions for mosquito breeding, turning the beautiful island into a hotbed for the dengue virus. These breeding grounds, abundant across the island, became the front line in this battle against the outbreak. The severity of the situation was palpable. It was not just an issue of public health, but an issue of survival. The declaration of a public health emergency was more than just a bureaucratic move. It was a desperate call to the world, a plea for assistance in tackling this escalating crisis. It was a signal of the desperate need for action, for intervention, for help. This was a desperate call to arms, a plea for help in the face of an escalating crisis. In the wake of the emergency declaration, the island found itself battling not just dengue, but fear and uncertainty. The immediate aftermath was marked by a flurry of activity as health officials, community leaders, and residents scrambled to stem the outbreak. Mosquito breeding grounds were targeted, and public health campaigns ramped up to inform and protect the population. Yet, the declaration also revealed the vulnerability of Puerto Rico's public health system. The potential for long-term implications, such as strains on healthcare resources, and the physical and emotional toll on the island's residents, looms large. As we stand on the precipice of an uncertain future, one thing is clear. The fight against dengue in Puerto Rico is far from over.